for you, Rebecca. Just that I know that during the US elections, for example, Facebook, as still is, was able to temporarily put in measures that safety systems to reduce misinformation. My understanding is, though, that they were switched off again after the US election. And just, is that the kind of safety, sort of more broader safety approach that Facebook is looking at? And if it was successful during the US election, or deemed to be successful, why isn't it still in place? Because, for example, we're all dealing with a lot of COVID and vaccine misinformation, for example, and wouldn't Facebook have a role in that being a current challenge that's on a similar scale to the US election?
Yeah, I wish we were able to switch off misinformation during the election. Our lives would be much easier. I think we switched off a number of different things in the last few days of that election, including around political advertising. And what we were trying to do there was reflect the extraordinary circumstances that we saw in the US around the election, and then again around the inauguration day. So there were some things that we switched off. And I think the Law Commission were quite interesting when they were talking in their evidence about reflecting the context in which posts and online conversations are happening. So that was why we did it, but it was reflecting that circumstance on the ground. On your point about COVID, I absolutely agree. We have been working very hard since the beginning of the pandemic at the start of last year to support public health efforts and government efforts. And one of the things, to respond directly to your question, that we no longer recommend health groups. So health groups can be really important and valuable ways of people with certain conditions to find a community and connect online and share information. But one of the things we learned during the pandemic was actually in that particular context, it's more important that people get their information from authoritative sources and public health bodies. So we built a COVID information center. We had it at the top of everyone's newsfeed. We directed tens of millions of people from the UK towards that information. And we didn't remove those health groups because, as I said, by and large, they do play a very important role for some people to discuss their health concerns. But we no longer recommend them to anyone because at the moment we think it's more important to direct people towards those formal sources of information.